Hello and welcome to the Friday Independent Sage briefing. Now, last week we began the first in a series of 6 sessions discussing the upcoming public inquiry into COVID-19. Since the start of the pandemic, Independent Sage has been the only group who's met regularly to engage with the public and provide them with robust data and transparent, consistent advice. Public health is at the heart of what Independent Sage does, and this group has met every Thursday to discuss the pandemic and every Friday to share expertise and listen to the public's concerns. Now, today's session will focus on the impact that the pandemic has had on education. For nearly 2 years, children have had their school lives disrupted by lockdowns, school closure, the need to self-isolate, while teachers have had to grapple with ever-changing guidance and staff absences. Over this winter, the highest infection rates in the country have consistently been among school-aged children. So if education is something that our society claims to care about, then how did we fail our children so badly? And what lessons need to be learned? To help us answer this question, we're delighted to welcome special guests. Dr. Deepti Gurdasani, a clinical epidemiologist, statistical geneticist Claudia Hanson, associate professor at the Karolinska Institute in Sweden and the London School of Hygiene and Tropical Medicine, and Kevin Courtney, joint general secretary of the National Education Union. So before we get going on this discussion, we're going to go to Dr. Deepti Gurdasani, who will present this week's numbers. Deepti, over to you.
Thanks. I'm just going to share my slides first. Great. So honored to be presenting this in Christina's place today. And I thought I'd just give a basic update on what's going on now and then focus on children and COVID. So I'm going to start with cases first. Based on the Office for National Statistics prevalence data, which is a random sample of the population. So it's not affected by the sort of problems we are having with other data sets now, which is, based on testing. We essentially see that case rates are still very, very high. So in England, for example, 1 in 25 people are still infected. But what we're seeing is declines in infection prevalence in all nations except in Scotland, where concerningly the prevalence appears to be rising. And if you want to dig down a bit more into why this is happening, if we look at the case data in Scotland, so this is not the random surveillance data, but rather based on the routine testing data in Scotland, what we see is a pattern where cases are declining in under 60s, but are rising steeply in above 60s, which is obviously problematic because this is the group that's, most likely to get hospitalized and indicates that we will likely see an impact in hospitalization soon. If you look at the prevalence by age in England, it looks like cases have dropped in all age groups, although, as I said, they still continue to remain high and seem to be the highest in primary school age groups, which are obviously the least vaccinated at this point in time. If we look at hospitalizations, once again, we see that hospitalizations are dropping in England, and if these are not all hospitalizations due to COVID, about 45%, so almost half of these have COVID as a primary cause. That doesn't mean that in the other hospitalizations, COVID hasn't contributed to hospitalization. We don't have that data. But if we hone down a bit more into other nations, what we see is that, again, hospitalizations are dropping in other nations as well, except in Scotland, where declines seem to have plateaued, which is in line with the data that we are seeing from the ONS and the increase in cases that we are seeing in the over 60s. So it's likely that this trend will continue. If we look at hospitalizations by age in England, what we see is a pattern of decline in all age groups, but concerningly, we continue to see during the Omicron wave that hospitalization rates in under 5 are higher than we've seen before, in that they're similar to this should be 64-year-old, not 74-year-old, 18 to 74-year-old age group. Although in the past, you can see that generally under 5 hospitalizations were much lower than in adults. And, if you want to look at the reason for that, this is a report that's recently come out. It's a preprint from Cambridge and Imperial that suggests that the risk of hospitalization in children under 10 from Omicron is similar to Delta. So while Omicron seems less severe than Delta with respect to hospitalization in adults, this does not seem to be the case in under 10s. And what seems to have happened is, because it is less severe, we've allowed much higher infection rates, which have disproportionately impacted children. But in children, the severity has been the same, which has resulted in hospitalization in children being higher than at any point before. But thankfully, that has peaked and is on the decline. I do want to highlight that, we're not out of the woods yet. So while pressures on the NHS seem to reduce because of COVID hospitalizations, we need to remember that there is a cumulative impact from the pandemic on the NHS. And the NHS is possibly in one of the worst situations that it's been. And this is data up to January 2022, which shows that the waits in A&E, so people waiting for more than 12 hours for admission, is much, much, much higher than it's ever been. And we need to remember that the impacts on the NHS are going to be cumulative over time, not necessarily depend on just what's happening with COVID at that point in time. Looking at deaths, it looks like deaths are also dropping, both based on the ONS death certificate registration of deaths as well as the 28-day definitions. But we're still seeing about 880 deaths per week based on the 28-day definition. And, that is a significant number of deaths because of COVID. And if we look at excess deaths, and this is a plot that many might be familiar with because it was presented at the briefing recently by the CMO, looking at excess deaths. So excess deaths are the number of deaths that are above what we expect from the baseline. The baseline used here is pre-pandemic, so 2015 to 2019. And what we see is that excess deaths are below average, but COVID-19 deaths are still significant. So why are they below average? Looking at the reasons, what we see is there's a huge drop in excess deaths because of acute and chronic respiratory disease, which makes sense given that we still have behavioral changes. We have a level of reduced mobility, people wearing masks, social distancing. So that will have reduced other respiratory diseases. And this is not new. If you look at data from January, you see while excess deaths were high, the baseline was actually, the non-COVID deaths were actually quite reduced. So if COVID was low at that time, excess deaths would have been negative at that point as well. So excess deaths being low is not a reason to ignore COVID deaths, because COVID deaths is still higher than they were over the summer, over most of the summer. And this is a slightly worrying trend. So these are excess deaths by place of death. And if you look, these are deaths at home, and they've been higher than baseline throughout the pandemic. And this is not related to lockdowns, because you see these even at points where there were very few restrictions in place. So it seems like there's a shift in place of death from hospital to home. And we're seeing about 400 excess deaths per week occurring at home. Whether this is because of pressures on the NHS or perceived pressures on the NHS isn't clear, but it's something that needs closer looking at. Looking at vaccination, I want to focus on this bit. We still have 22%, and that's 1 in 5 people in England who remain unvaccinated. The vast majority of these will be children. 56% are boosted, and that leaves a lot of people who are not fully protected, given that we have the Omicron variant now. And, to have a high level of protection against infection, severe disease, you do need a booster. So that means a significant level of the population doesn't have full protection yet. So now I'm going to move on to talking a bit more about children and SARS-CoV-2 to focus on the discussions that we're going to have later during this session. And I know this is a busy plot, but I just want to highlight this is essentially the ONS prevalence by age group across the entire pandemic. And the things to focus on are the orange line and the red line, which are essentially the prevalence rates in school-age children. And The white periods here are the periods where schools were open, but there were no masks in place. And you can see that during those periods, we've seen consistent rises in prevalence of infection among those two groups, so children. And in many cases, you'll see that the prevalence in children has been the highest across all age groups, or amongst the highest across all age groups. Similarly, if you look at the blue shaded parts, those are school breaks or holidays. And during each of those bits, you will see that there's a decline in prevalence alongside those or just after those. And here, for example, you can clearly see that secondary school children, for example, at the highest case rates, they drop during Christmas break, and this drop in children precedes the drop in other age groups. So not only do you see this pattern of prevalence in children going up and down as schools open and close, depending on whether mitigation is in place or not, but you also see the same pattern reflected in other age groups, which shows that schools have a significant effect on prevalence, not just in children, but also in the community. And I'll be coming back to discuss that in a little bit. So this was some data that came out very, very recently from the ONS, which has modeled the seroprevalence, so the level of antibodies which indicate the level of exposure in children to SARS-CoV-2. And this is data from the 4 nations. If we focus on England here, because the data is similar for England and Scotland, a bit lower for Wales and Northern Ireland, 82% of children, the 8 to 11-year-old age group, are estimated to have antibodies to the virus. Now, if we look at this, we can see that since we've had data, we've seen a doubling of this seroprevalence from about 40% to 80% in just the last month or so, so over the Omicron wave, 2 months probably. And this is the point at which MHRA approved vaccines for 5 to 11-year-olds. So at this point, the prevalence was about 40%. So this is to highlight how rapidly exposure has accrued in children, and potentially vaccination rollout at this point, like we did with boosters, could have prevented at least some of this. And, to understand what does this mass exposure mean for children? I mean, we know it's come at a cost, which I will discuss, but does it provide long-term immunity to children? And this is data from the UK HSA looking at BA2 infections. And these are new first BA2 infections that we're seeing in different age groups. You can see that they're again quite common in children. But if we look at reinfections, and we know that these are reinfections because we're looking at a new strain of the virus. So these are people that were infected with another strain before and are now infected with BA2. We see again reinfections are concentrated in children. And there are 2 different types of reinfections. So in gray, you see the ones that have happened after 3 months of the first infection, and in orange are the ones that have occurred within 3 months of the first infection. And what you see is that reinfections are occurring within 3 months in children, and they form a significant proportion of all the reinfections to date. So this is really concerning because it suggests that, at least for some children, we're clearly seeing reinfection quite rapidly after previous infection. So we've talked about exposure to children, but I think there's a rhetoric here that, infection might be good for children because it provides immunity. But let's see what the cost of this infection of children has been. If we look at severe disease, so we'll start by looking at hospitalization. This is a study published in Eurosurveillance that looked at hospitalizations with COVID in 10 European countries, including Germany and Italy, over a period of time between August 2020 to October 2021. And during this period, there were 9,600 hospitalizations in these 10 European countries, including large countries like Germany and Italy, and there were 9,700 hospitalizations in England and Scotland alone. So this should show us that, this, I guess, wasn't inevitable, and there are countries that did much better. And if you want to look at the total number of hospitalizations with COVID, that's 22,000 in the 0 to 17-year-old age group in England and Scotland to date. And many of these did occur during the Omicron wave. So let's look at deaths. I mean, we often hear that deaths in children are far less common in adults, and that is true, but that's a false comparison because deaths from all illnesses are less in children than adults, and that doesn't mean we don't prevent them. So let's try and compare COVID to other childhood illnesses. So if we look at the death toll based on, this is from death certification. So these are deaths involving COVID, where COVID was mentioned on the death certificate. In children under 18, we've had 72 deaths in England and Wales, of which 10 have happened in January alone. This is not up-to-date data. If you look at up-to-date data, which is only provided in the 0 to 19-year-old age group, then we see 99 deaths as per ONS death certification. But if you want to compare the annual deaths because of COVID, let's compare 2021 in England and Wales with deaths from other diseases in 2019. You see that it exceeds deaths for flu, rubella, measles, mumps, and varicella, and is probably comparable or lower than deaths from flu and all-cause pneumonias. So it's a significant cause of death. And if you look at CDC data, which was recently presented by their vaccine group, it shows that deaths from COVID-19 in the 5 to 11 year age group is quite significant when you compare it even to the pre-vaccine era. This is before vaccinations were introduced for all of these other diseases. Of course, the age groups vary a bit, but you can see that COVID deaths would still be significant compared to these. And of course, the cost of long COVID. And here is the data that we have up to date on long COVID, self-reported long COVID for 4 weeks or more in children. And what we see is long COVID tripled in a period of 4 months up to December, and since then seems to have stabilized. And of these 117,000 children who report long COVID now, 58,000 report limitation of activity, and 20,000 have had illness for more than a year. Now, I can't think of another disease where 20,000 children have long-term symptoms lasting for more than a year. And we need to remember that this is data for infections up to the beginning of December, because this is in long COVID being reported in Jan. So the impact of the Omicron wave isn't seen in these figures yet, and we will figure that out in the coming months. And it's not just children. Another an occupation where we see disproportionately high long COVID rates and rapid increases in long COVID rates has been teaching and education, where about 3% of staff now have long COVID or self-reported long COVID. If we look at educational disruption, because this is the aim stated by the government that they want to prioritize education, we see there's been mass educational disruption. And at the peak of the Omicron wave, about 400,000 children were directly absent due to COVID. Now that's declined to about 180,000, but we're still seeing significant educational disruption in schools. And if you want to understand the impact of this educational disruption, it is unequal. So this is a graph showing the lost learning in months in October 2020 and in July 2021. And we can see that there was significant loss of learning October 2020, potentially because of school closures. And you can see that it was quite disproportionately higher in pupils on free school meals compared to those who weren't, both in math and reading. And while there was catch up in July 2021, you can see the disparities between children on free school meals and non-free school meals still remain. So the impact is very likely to have been unequal across society. And this is something that's really tragic, but we don't talk about much. But children are very much a part of society, and they're not just impacted by direct impacts on their health, but also the health of their carers. And they're estimated that about 12,000 children in the UK have been orphaned, lost either one or both parents to COVID. And this doesn't even include the impact of long COVID, which often happens within households. So the impacts on children are much greater. So coming back to this plot, which I want to highlight, there are very few periods during which we've had mitigations in schools, and we've seen the impact of that now in England. And, what have we done about this? So vaccine rollout has been delayed, both in adolescents and now in younger age groups. And what we're seeing here is really concerning. Only 23% of 12 to 15-year-olds have had 2 doses of vaccine. And we know that with Omicron, you need at least 2 doses of vaccine and preferably a booster. So very, very few children have the level of protection that they need to have. And this is far lower in England than in Scotland as well. And there has been a broad impact on COVID-19 mitigations that we don't talk about. I mean, I talked about the reduction in excess deaths across all age groups, but this is an article published in the BMJ. And if you look at hospital admissions for many, many different diseases, very pink means very high levels of admissions, white means low level of admissions. And you can see 2020 looks pretty white, which means admissions from all causes were reduced. And meningitis admissions were reduced by 50%. So this is a level of reduction. At 0 means there's no reduction. 100 means they're almost eliminated, right? And 50 means they're halved. So meningitis admissions were halved, and influenza admissions were reduced by 90%. Influenza was almost eliminated in children. So, we need to really talk about the benefits of mitigations, not just in terms of COVID, but in terms of the broader benefits, which I think we don't really talk about. So moving on to, why has all this happened? And I think one of the concerns is the public messaging by government and scientific advisors has been very, very confused and has generally minimized the role of children in transmission as well as the impact on children, with JCVI at points arguing, even in their minutes, that it might be good for children to get infected rather than vaccinated. And the other problem is transparency. So, there are allegations against government for having suppressed data around schools at critical points in time, and also evidence around policy not being released because of claims that it's in the public interest not to do so. And there's also been a lot of pressure lobbying and misinformation that's been spread by many different groups, which have had disproportionate influence and support from government ministers. And all of this needs to be understood better. So to summarize on the situation update today, cases are declining in all nations except Scotland, where rises seem to be driven by older age groups, which is concerning. Unfortunately, despite declines, case prevalence still remains very high, and it remains to be seen what will happen given the recent dropping of self-isolation and mandatory self-isolation and contact tracing. Hospitalizations are declining in all nations, but not in Scotland, in line with the increase in cases in older age groups. Deaths from COVID appears to be declining, but still remains significant. And in terms of impacts on children, Omicron wave has resulted in mass exposure of children. Unfortunately, we don't know if even this exposure, despite all its costs, will provide long-term protection, because we are already seeing significant proportion of reinfections that are happening within 3 months with BA2. And we see significant costs of this approach of mass infection. We see that hospitalizations have been greater than many other countries. Deaths are higher than those from many other childhood infections. Even in the pre-vaccine era, there's been a substantial long COVID cost that continues. There's been educational disruption that has impacted children unequally. And unfortunately, vaccine uptake remains very low in children. And with continuing high prevalence of infection, it's very likely that children who are likely the most exposed, the least protected, and the least vaccinated will continue to be impacted disproportionately. Yeah, that's it from me. I'll stop sharing now.
Thank you. Oh, sorry, Jim.
No. Thank you. I'm not quite sure who's handing over to whom, but I think I'm handing over to you, Steve, to start the discussion with our two guests.
That's right. Thanks ever so much, Jim, and thank you, Deepti. And we'll definitely be coming back to your encyclopedic knowledge in this area, and when we have our questions amongst our panelists. So it's my job today to sort of facilitate discussions in this area. And really, I'm not going to say very much at this time. I'll have a brief summary of what Independent Sage have been talking about with respect to schools at the end of our panelist session. But suffice to say, I think everyone can agree that schools should always be the last things to close and the first things to reopen. And it just strikes me that this incredible paradox between people actually railing against the actual safety measures and mitigations that allow them to stay open is just crazy, really, is my view. So we're going to hear a bit about that. And of course, I think that Eurosurveillance paper that Deepti mentioned in the presentation just then says it all, really. So I think we're going to hear some interesting insights around policy in the UK and what we've learned from Kevin Courtney from NEU in just a moment. And then we also have Claudia Hanson joining us from the Karolinska, who's going to give us a European perspective on perhaps what we may have done differently or what has been done differently in Europe. So I'll very quickly be quiet and mute myself and hand over to Kevin. Thank you so much, Kevin, for joining us today.
Thank you very much, Steve, and thanks to Independent Sage for the invitation to be here. Since the start of the pandemic, the NEU's objective has been to follow the science as best we can, to speak truth to power, and to try and minimize the disruption to education whilst keeping society safe. And we think this notion now of looking back and trying to work out what the inquiry should look at really matters. There has been far more days lost to education in England than in the vast majority of European countries. So there is something to look at why that has happened. There is also really clear data that we've amassed ourselves showing there's been more days lost to education for children in the more disadvantaged schools. We want that looked at. Now, we'll be participating in the inquiry through the TUC as much as we can and raising many issues, but I just wanted to touch on some of them today. We want the inquiry to look at preparation pre-pandemic. We want it to look at the timeliness or not of some of the decisions that were made. We want it to look at the investment in solutions during the pandemic. And we want to look at some specific decisions where we think government just flew entirely in the face of the scientific evidence. So on the sort of preparation pre-pandemic, there were significant funding cuts in our schools from 2015. And amongst other reasons, other cuts, that led to us having the largest class sizes in primary and secondary schools that we'd had for decades. And they're the largest class sizes in Europe. And we have quite poor space standards in our schools. So when the pandemic hit, our classrooms were perhaps the most transmissive, if you like, for the virus across Europe. We think that should be looked at. There's another example of preparation. The growing inequality in our country means that many children, and this number was increasing, didn't have good situations at home in terms of laptops, broadband, etc. That made teaching online more difficult. And a third example of preparation pre-pandemic is that since 2014, the amount of emphasis placed on teacher assessment for GCSE exams and A-level exams had been ramped down to almost zero. And that made the whole exam system far more brittle when schools had to send most children home for a significant period. So that I think the inquiry should look at the situation in our schools pre-pandemic. But the timeliness of decision-making during the pandemic as well. Some of these things obviously matter in more than education, but did we go into lockdown in March 2020, a fortnight, 3 weeks too late? Certainly we felt that was right, and we're calling for schools to be sending most children home at an earlier stage. Did we stay in for not quite long enough when cases were halving? And those things, and did we look, should we have had a circuit break lockdown in the autumn half term of 2020, when cases were certainly rising very quickly in our schools, as Deepti showed just now? So those timeliness questions we think we need to look at. Investment during the pandemic. I mean, there's all the questions that other people will raise about whether the money was best put into a privatized test, track and trace rather than a local government public health test, track and trace. But from our point of view in schools, when we got cases down by the summer of 2020, we were calling for a plan B to keep them down. We were saying, let's mobilize retired teachers, supply teachers, let's find extra spaces, let's get class sizes down to where they are in Denmark, where schools had opened and managed to stay open. The government didn't follow that. And I think that's worth looking at why they didn't invest in that, but also why they didn't invest in the almost simultaneously call from SAGE for investment in ventilation. Now, obviously, you don't know at the start of the pandemic what the fundamental means of transmission is, but when SAGE was saying ventilation really mattered, we thought the government should be investing in that. And I'm afraid it looks to us like they didn't invest in ventilation before the Alpha wave, which would have helped. They hadn't done it before the Delta wave, and they hadn't done it before the Omicron wave. Now, in some cases, Well, we think that's led to much more disruption in education than we needed to have. We didn't get CO2 monitors rolled out. Sage said ventilate in summer 2020. CO2 monitors, which don't do the ventilation themselves, didn't start getting rolled out till September 2021. So more than a year later than that. And we think that really needs looking at. And some of the decisions that we think flew in the face of science, the decision by the Secretary of State to threaten Greenwich with legal action when they, in the face of the alpha wave, wanted to close their schools in the run-up to Christmas 2020. The decision by the Prime Minister to advocate opening of all primary schools on January the 4th, 2021, when he spoke to the Mar show that Sunday morning. And then his volte-face by Monday the 4th of January, when he'd had to change his mind. Now, we think that a decision we made, we had a meeting of about 400,000 members on Sunday, January the 3rd, and we said we thought that members could safely send a letter to their head saying under health and safety legislation that they thought it wasn't safe for them and for society to be in school. But some schools did open the next day and will have spread the virus. And our members shouldn't have been put to that situation of having to do that. So why the government ignored the advice that they clearly had about where the R rate would be, we think really matters. And then we do not understand the decisions that have been made about the withdrawal of mask mandates in the summer of 2021 and even more recently. We think those things could have led to less disruption in education, and we hope the inquiry will look at those matters. Like I say, thanks very much for the invitation to be here.
Thank you so much, Kevin. As you say, there's so much to to focus on. It's almost impossible to catalogue, and I guess the complexity of that graph that Deepti showed in the presentation with all the different ups and downs and different mitigations as well just shows how haphazard this really has been. So that's really interesting, and we'll come back to lots of this in the questions afterwards, I'm sure. But for now, I'd just like to hand over to Claudia Hanson from the Karolinska, who's going to give us some perspective from a European standpoint and also a Swedish standpoint around how schools have been managed and where it really differed from the UK situation. Over to you, Claudia. Thank you.
Thank you very much, and thank you very much for inviting me. So I'm German by background, but I'm living in Sweden and working at Karolinska Institute since 10 years. So I have a little bit both perspective. So as you all know, Sweden had not really had any lockdowns and had only through very short periods actually closed the schools. On total, it's maybe something like 3 weeks in the pandemic, a little bit longer for the grade 3. So I mean, it's clear. So Sweden has from his constitution and from the whole fabric a lot of emphasis on doing everything for the children right and doing everything right for the family. So that's a very crucial value. But in view that here during the pandemic, actually also the population was never informed that there is transmission in children, and that there are serious consequences, and that children also can transmit the disease. So there was never pressure actually from the population to change anything. And as you all know, there have never been mask mandates in the country. So mask mandates were never introduced in school, but it was also because it was very lately, if ever, actually been released that it's an aerosoling disease. So there was also never any discussion on HEPA filter, opening windows, and all these things. And I have been trying at my institution, Karolinska, to actually open windows, and it's just a battle which you can only lose. But to some extent, it hasn't never been that serious as one should expect, because people have been staying home. So that is the way how the whole thing has been handled, and why it didn't go up so fast. And much of the workers are also able to stay home because the jobs are somehow a little bit different. So that society, I would say, did care a lot about the children, and I think it's probably the European countries with the least loss in education. probably what is coming out in the end. Yeah, but a lot of children also being infected, and I would always say it just did do below potential. Yeah, so that's for me the sad thing. So with easy measures like opening windows, much more could have been done even without closing school. So the German example is very much the opposite, where I would say there is a strong political and also societal recognition of the spread in children, that it's that something has to be done, that school should be safe. Yeah, and very early on, actually, a recognition, we need the HEPA filters, we need to open windows, and so on. But then in the end, this country, for me, got stuck with actually the implementation. So in part also because of the federal system of funding flows, yeah, but also not being able to trust the teachers sufficiently to actually put up a proper community-based approach. So where the teachers actually could say, okay, this is what we do in our school and this will work. And then Germany had a very strong testing in schools. So depending on the state, at least twice a week. And that created a huge uncertainties in the family as also in the teachers. So it took time away from teaching, but it was also never clear for a woman working. So is my child now sent home again, or can it go to school? What am I doing? And that created quite a lot of probably burnout, particularly in women, but also in teachers, and many teachers actually having families. So it was every week somehow another problem, another disaster, another yeah. So it was not enough enough will. Yeah. So it was a political and societal will, but not enough money actually then to have creative solutions to get more people doing something, help the teachers, so that it put actually too much burden, I would say, on the families, teachers, and the school situation. Yeah, with also too long school closure, because then in the end nobody did know anymore what to do than to close the school. So as two actually examples a little bit at the extreme.
Wonderful, Claudia. Thank you so much. It's always really interesting to hear, particularly about Sweden, where the impression by many is that the Swedes really did nothing, and that clearly isn't the case. It was all to do with staying at home and small households and other mitigations. It's really fascinating.
Yeah.
Maybe I could
also there were measures. Yeah, so sure. Really the big events were closed. It was also down to 6. So it is not true that nothing has been done. Yeah, and it was also easier to do in such a society.
Yes, absolutely. I'm sure. I mean, maybe I could just start with you then, Claudia, and ask. I just wondered, from a European perspective, was there anything that England or the devolved nations did in terms of school policy that was actually looked upon as a good thing and that other European countries followed? I'm just interested to know.
So, I think the most fantastic thing is that you could provide the data and the science. Yeah. So, we have all been stuck with the science. It took a long time actually to be clear. So, how much do children infect and how much do they transmit? Yeah. So, it was the UK studies which really showed the whole thing. Yeah. And in Germany, it has been referred a lot. So, saying again and again, so, another fantastic study is coming out of the UK. So, okay, also a few coming out of Denmark. Yeah. Where I think many people also got really angry with is that Sweden actually could have provided the world very early on with the data that there's transmission in children, but they didn't do. Yeah, so they didn't invest in it. I have been asking it out, can't you do a simple case control study in pregnant women and find out that those who are primipower and those who are multipower, whether they have higher or lower transmission, because that would have given us in May, June already an indication, because they had in Stockholm a quite good first wave, which would have delivered some data, but it was completely impossible to get anything out. Yeah, and that could have, because then we would have been clear. It is of high value to keep schools running. Yeah, then we have to do other things if there is transmission. Yeah, so it's about not putting the head in the sand, but facing it and do everything else to keep the schools open.
No, absolutely. Thank you.
Yeah,
Claudia.
so let the parents stay home instead of the children stay home.
Yes, that sounds really refreshing, actually. Can I ask Deepti to comment on the recent announcements that the vaccination in 5 to 11-year-olds is going to be non-urgently rolled out and possibly not until April? What impact do you think that might have upon the continuation of the Omicron BA1 and the potential exacerbation of BA2 in schools?
So I think we remember that 5 to 11-year-olds are an unvaccinated group. They're a group with very high levels of exposure now. So the least vaccinated, possibly one of the most exposed groups. And what we're doing now is we're sort of saying we'll tolerate a very, very high level of cases because much of our population is boosted, vaccinated. But that's going to impact children because they haven't been vaccinated and they have higher infection rates, which means that they will continue to face impacts that are higher than before because we're tolerating that high level of infection because we're not seeing adults in hospital, you see. And in the midst of that, we've taken away contact tracing in schools. We're taking away asymptomatic testing in children, which is critical to find transmission. So I'm really concerned that children will continue to get infected because there are many studies now that show that natural infection doesn't confer long-term natural immunity against infection in children. I don't know what protection it confer against long COVID and severe disease, but children will continue to get infected. I mean, we've seen the mass exposure in simply the last 1 or 2 months, which is shocking when children could have been vaccinated. So the idea that, the contrast between the massive rollout of the booster program when the Omicron wave started, which massively helped to control the Omicron wave, and the complacency around children, when in the US, more than 8.7 million children have been vaccinated in that age group is something that I don't think I understand. And it's something that I hope the inquiry will focus on.
Yes, absolutely. Me too. And I genuinely think that the messaging around that vaccination program is almost certainly going to hinder uptake rather than help, is certainly my view. Kevin, could I ask a question about whether or not any of you have heard anything around guidance, around students coming back, pupils coming back, when they have experienced long COVID complications, and if there's any support that's being put in place for teachers?
Well, we're engaged with the Department for Education in a set of discussions about a very large number of children who aren't in school now, who would have been in school pre-pandemic. And it's not quite clear what all the reasons for that are. Some children may have chosen, who thought they weren't going to do well in the exam system, to leave education earlier than they're allowed to. Others, there may be some worry about their personal CEV status or the status around their family. And then there are yet others with some long COVID symptoms. So we're working with the department. Those children really need our support, obviously. And with more time, we should talk about education recovery. That we really need to have, and a huge investment that is missing in our country. That that the government's education recovery czar, Kevin Collins, wanted something of the order of £15 billion and resigned because we were given nothing like that for education recovery. And we need that money for those children with long COVID as well as other children.
Absolutely. And I think something that you just said there is probably going to link into my very last question, which any of you can possibly answer, and that's about clinically vulnerable children and also children in clinically vulnerable families. With this, we're hearing that there are mandates for these children to be sent back into school regardless, linked in with a sort of stuttering vaccination response. And of course, much like in the first waves of the pandemic, when shielders stayed at home, that means that the people that are more susceptible aren't being exposed to the virus. So perhaps that's something that does keep those rates down that Deepti was showing in these graphs potentially. If the Department for Education are forcing children and parents to go back into education in those circumstances, what do you think that the consequences are going to be in terms of schools? I mean, in the UK or indeed in Europe? Deepti?
So the Department of Education has had this policy of mandating attendance at all costs without making schools safe. So that means that children have been, even clinically vulnerable children, or children living in clinically vulnerable households for whom, let's remember, the vaccines were also delayed, have been forced into unsafe environments where if parents have resisted that, they've been threatened with prosecution. Some of them have had to go to court. Some of them have faced fines. Some of them have had social services called on them because they wanted to keep their families safe. And for them, I feel there's no end in sight. Essentially, parents are now having to choose between deregistering their children, which is essentially off-rolling children, because they have to make a choice between their children's education in school and the health of their family, potentially their own life or their child's life, which I think is a very unfair choice, because surely safe education and health should be a right for everyone, and we should be aiming to make schools safe for everyone so that there isn't a group that's left out of education and society.
Completely agree. Kevin, did you want to just make a brief comment?
Yeah, I need to be really careful on what I speak on. I'm not an epidemiologist, or I used to be a physics teacher, and now I'm a union officer. And I don't want to go beyond my competence in these matters. We've been pressing the department to give clearer advice to the families of children in these areas of why they're making the decisions they are. But I just wanted to pick up on the point that Deepti made. If there were investment in ventilation, and this could have started in the summer of 2020, that, at the moment we've got the CO2 monitors in most schools, but then the government is saying that only if the parts per million of CO2 is 1,500 parts per million, then you get an air cleaning filter. I think that's not the right level. We've seen studies from Harvard suggesting that cognition starts to drop off. You start to feel a bit more tired when you're over 800 parts per million. Now, that's not a COVID question, but it is a teaching question. And I think an investment that said that we would have sustainable, so climate protected methods of ventilation that gave us good levels of, reduced levels of CO2, that would improve the resilience of our schools for any future variant of COVID, but also for other airborne diseases, for the flu, etc. I'm not an epidemiologist, but I think I'm right on that.
Well, that BMJ article that Deepti showed points to that very clearly, doesn't it? Okay, so Claudia, do you have anything to add there, or is that all good?
I also see a huge potential actually of learning on long term. So really we see now that certain diseases have gone down. So why should we not want to prevent actually this disease, this deaths and these diseases also in the future? And if, for example, it really makes sense to have a mask in the public transport, then I just ask myself, what's the problem? Is this not something which we should have as a culture also long term to protect the society? And otherwise we have a lot of things also to learn. So how can we use maybe blended learning also to have more inclusion also in certain situations? So I think we haven't done enough, and there's a lot of possibilities, but there is a huge underfunding probably in all countries of the educational sector.
Yeah, couldn't agree more. Okay, well, in the interest of time, guys, I think, and with wanting to take some questions from the press and public, we're going to move on. Just for me to say very quickly that the Independent Sage, as Jim said at the beginning, has been invested in schools and education, and indeed in universities, over the course of the pandemic. We've regularly met about this, and we've regularly published documents, and I counted something like 21 different documents around schools and universities on the Independent Sage website. They're all there to look at, and I think it's safe to say that we've largely been in agreement, as it turns out, with NEU and with Sage, in terms of the modelling and predictions, in terms of what should have been done with respect to keeping education safe for all. And I very much hope that things will improve going forwards. So now I'll hand back to Jim, and hopefully we can hear some questions from the public.
Thank you very much, Steve. Yes, a vital topic that we're discussing today. We've got about 10 minutes left for questions, but I think it was important that we heard from our guest today. So we now move on to questions both from the public and the press. And first up, we have Caroline Ashton. Caroline, do you want to ask your question?
Hi, thank you. You've kind of talked a little bit about this already, but my question was about good evidence, about where different countries have done different things. What's the clear evidence of actually what the outcome is, as in reduced admission? So Deepti has mentioned some of this already. So different, reduced admission, reduced sickness, reduced absence. And that's for both teachers and for children. So things like vaccinating teachers as a priority, vaccinating children early, mask wearing, ventilation, all those things. And also, I suppose, where do we go from here to get the UK into a better situation for the future? Thank you.
Thank you, Caroline. Who would like to address that one? Deepti, yes, please.
So I think there's a lot of evidence on the efficacy of different interventions, such as masking and ventilation in schools, and reducing school outbreaks and reducing educational disruption. Of course, it's sometimes difficult to tease out the independent effects of different actions, but we do see that countries in Europe, which have had masking in schools in both primaries and secondaries for much longer than the UK, and in some cases, medical grade masks, there's been far less educational disruption in, for example, France and Germany. And if you look at the US, there are many studies now from the CDC showing that counties which had masking mandates, so schools where masks were used and where ventilation was prioritized, including HEPA filtration, reduced school outbreaks, reduced absenteeism from school outbreaks. So there's a lot of observational evidence, but I worry that people are looking for sort of randomized control trials here, which is not what we should be aiming to do, because even the physical evidence from HEPA filtration is so strong, and this is an aerosol transmitted disease, that we need to essentially focus on taking the steps that I think there's enough observational evidence that shows us that they work, rather than accruing more and more evidence while children get infected.
Thanks, Deepti. Kevin, you wanted to come in.
I think Caroline's question is really important, that it's vital that the inquiry, I think, looks at those things. I just wanted to say that it seems to me, as well as looking at the interventions that governments pursue, you also have to look at something I tried to raise at the beginning, the state of our schools. And are our class sizes higher than other schools? Is the combination of that and space standards, does that mean it's easier for the virus to transmit in our schools? So I think you have to use that information in considering those interventions.
Thank you. Thank you very much, Kevin. Okay, so the next question is a member of the press, from Matilda Martin from the Times Educational Supplement.
Hi. So today the DfE kind of said that, obviously they're getting rid of kind of legal guidance to stay at home with COVID, and it said that schools can refuse entry to pupils with COVID, even though it's kind of not legal guidance anymore. So my question would be, is it fair to ask heads to decide on public health policy without that kind of like backup via national guidance on managing the COVID spread in schools?
Thank you. Deepti, you seem keen again, so back to you.
Yeah, it's been a mess right from the beginning. They did the same thing with mask use. In fact, at some point they, were putting pressure on schools to ban mask use. And the idea that, head teachers have to make this decision without necessarily even the data at this point in time, because, we're going to stop testing very soon. We're not contact tracing either. So what are head teachers going to do with these students? Who's going to do contact tracing? Is anybody going to do contact tracing? What are you going to do with the rest of the class that's exposed, including clinically vulnerable children many of whom will not even be vaccinated. I mean, I honestly don't know. As a parent, I am completely unclear what our school is going to do. And I have great sympathy with head teachers because they've essentially been hung out to dry for the last 2 years, and this is no exception.
Thank you, Deepti. There's a follow-up question which is related to this, so maybe we'll come on to that next in the last few minutes, and that's from Adrian Fayers. Adrian, over to you.
Hi, yes. Thanks for inviting me to ask a question. Something that I've been wondering about for some time is, for vulnerable students, don't some mitigations like adequate ventilation, air cleaners, perhaps even masking or mandating self-isolation qualify as reasonable adjustments under the 2010 Equality Act? And of course, the good thing about reasonable adjustments is more often than not, they protect more than the vulnerable, they benefit everyone.
Thank you. Kevin, did you want to come in on that? Because I think it's...
Yeah, I would, thank you. I think it's an important, we are certainly using that argument around our members who are vulnerable at increased risk, and including women who are pregnant, as well as immunosuppressed and others, and people who were formerly classed as clinically extremely vulnerable. And we certainly think that there needs to be a robust risk assessment, and as part of a robust risk assessment, looking at reasonable adjustments, making sure that people are in the very best ventilated rooms with the very best air filtration. We think that matters for our members who are, as has been said earlier by Deepti, are at a higher risk of contracting COVID, doing their best to keep education running, but because of that, at a higher risk of contracting COVID. And I think that argument can be extended to children who are vulnerable. The government does look at special schools rather differently to mainstream, and they are saying that they're going to carry on testing in special schools, but there are obviously many children with the same degree of vulnerability in mainstream schools who are as children in special schools.
Thank you very much, Adrian. If no one else wanted to come in on that, then maybe we should wrap it up there. So thank you very much indeed to our special guests, to Deepti, to Claudia, and to Kevin. Of course, to Dr. Steve Griffin for leading the session. Thank you to all the scientists, as always, and to you, the public, for sending in your questions. And sorry we didn't have enough time, but I think you'll agree there's been a hugely useful, we've had a very robust discussion on this issue. So please continue to send your questions in, and we'll try and get to them if we can. In the meantime, everyone stay safe and well. Goodbye.
Bye-bye. Thank you.